Hello everyone, I'm Dr. Jamuna Joy from Amala Institute of Medical Sciences and I'll be talking to you on ovarian cancer. The female reproductive system has two ovaries, one on each side of the uterus. The ovaries produce eggs as well as hormones called estrogen and progesterone. So we call it ovarian cancer when there is an abnormal growth of cells that forms in the ovaries, and these cells, they have a tendency to multiply quickly, invade, and further they affect the normal organs of the body. So it is of great concern because it is one of the leading causes of death in women with gynecological cancers. So for a patient with carcinoma ovary, we need details like the initial symptoms and their duration. Also assess her for her risks of getting an ovarian cancer, which includes a careful family history of both her father's side relatives and mother's side relatives, including those relatives without cancer. Also, we need to know any other medical history of comorbidities like hypertension, diabetes, or asthma, and if the patient was on any hormonal treatment, because all these can increase the risk of ovarian cancer and other diseases of the reproductive system, which includes fibroids and polyps, which are not malignant but can cause similar symptoms in a patient. Uh, and other details include personal history like addiction to smoking, alcohol, their menstrual history, if their cycles have been regular, their age of attaining menarche, their obstetric history, if there's any history of abortion in the family, etc. So the main symptoms that a patient comes with include abdominal distension, or they would have a vague abdominal discomfort, a feeling of a gaseous distension or bloating. The patient may also feel an abdominal mass and sometimes indigestion, acid reflux, or because of the abdominal distension, they can present with shortness of breath. Apart from these, when the mass is so large, it can cause pressure effects on bladder and rectum and eventually cause symptoms like difficulty in passing urine or increased frequency of passing urine, constipation, other symptoms like vaginal bleeding, also tiredness, loss of weight, loss of appetite, and early satiety. When a patient comes with these symptoms, the doctor examines the patient by a rectovaginal pelvic examination or a bimanual examination. Here, the doctor places one finger into the vaginal opening and another finger of the same hand into the rectal opening. The other hand is placed over her abdomen to feel the size, shape, and position of the ovaries and uterus. The ovarian cancer is rarely detected in pelvic examination, but in cases of advanced stages, bimanual examination may help in the diagnosis of ovarian cancer. So the ovaries are looked for lumps or changes in shape or size. Ideally, every woman should undergo a rectal and vaginal pelvic examination at her annual checkup with her gynecologist. Now, there is something called as the PAP test, which is a procedure done to collect cells from the cervix as well as the vagina. But this does not help in the diagnosis of ovarian cancer, but is used for the diagnosis of cervical cancer. Coming to the investigations, the routine blood investigations include complete blood count, a renal function test, and a liver function test. In addition, we need to get a CA-125 blood test done, inhibin B, inhibin A, and OVA1. OVA1 is a panel of 5 markers which help in the identification of carcinoma ovary. Now, the main studied ovarian tumor markers include cancer antigen 125, that is CA125, and human epididymis protein 4 or HE4. Now, these two tumor markers are typically raised in carcinoma ovary and they help in diagnosis of ovarian carcinoma. Now, apart from helping in the diagnosis, they also help us to identify how much a patient has responded to the treatment that she has undergone. So the CA125 is done as part of follow-up so that we can look at how much the levels have come down after treatment. Now, on removing the tumor surgically, we have a macroscopic assessment as well as a microscopic assessment. Macroscopic assessment is what we see with our naked eyes. So we can look at the size of the tumor, the shape of the tumor, the site of the tumor, and its typical appearance. The microscopic appearance is seen through the microscope. A pathologist describes the cancer as grade 1, grade 2, or grade 3. Grade 1 is most like the ovarian tissue, so most of the cells will have the appearance of the ovary, and a small number of cells have the tumor cells, whereas grade 3 cells are more immature and more likely to metastasize or are more aggressive. Coming to the pathology description, it includes details on tumor, nodes, IHC, lymphovascular space invasion, and finally the stage of the disease. So, describing a tumor includes assessing the size, extent of spread of the tumor, grade of the tumor, that is grade 1, 2, or 3, and type of the tumor. There are different types of tumor like epithelial tumor, germ cell tumors, etc., depending on which the treatment may also vary. We need to know the number of nodes that have also been included or involved with the tumor. This gives an idea of the extent of the spread of the disease. In certain cases, there may be a confusion or there may be a difficulty in identifying different types of tumor, and in that case, we have something called as the immunohistochemistry test that is done on the specimen. So, this includes special investigations or special tests that are done on the specimen, and this helps us to identify the correct type of tumor. Now, in the pathology reports, we will come across something called as lymphovascular space invasion. That is, the tumor cells may involve the lymphatic vessels or the blood vessels. So in this case, it will be reported as lymphovascular space invasion present or in lymphovascular space invasion absent. And finally, the stage of the disease will be reported in the pathology reports. There are four stages. Stage 1, in which the disease is confined to the ovary. Stage 2, the disease is in the ovary and outside also, but remains within the pelvis. Stage 3 is when the disease is outside the pelvis but remains within the peritoneum. And stage 4 is when the disease has gone beyond the peritoneum and has affected the normal organs of the body as well. We have certain radiological investigations that help us to diagnose ovarian cancer, which includes ultrasound of the abdomen and pelvis. It is the transvaginal ultrasound which is preferred, in which an ultrasound probe is inserted into the vagina and a detailed study of the uterus and the ovaries is done. But we have also the CT scan and the MRI scan of the pelvis, which helps us to study the uterus, the ovaries, the extent of spread of the disease, if any lymph nodes have been involved, how far the disease has gone, etc. There is also a PET scan, which is a whole body scan, which shows us where all the disease has spread, which all organs it has affected, and helps us to identify the stage of the disease. The treatment of ovarian cancer includes different modalities of treatment. Now, coming to the surgical treatment, doctors make an attempt to remove all the visible tumors, that is, removing the tumors as much as possible, which is called tumor debulking. But not in all cases it is easy to remove the entire tumor from the pelvic region. So that is when we get the help of chemotherapy. So chemotherapy is using special medicines to shrink or kill the cancer. Once these cancer cells have been shrunken to as much as possible, then surgery becomes easier to do and we get better results. So chemotherapy drugs can be taken orally, that is as by mouth, or can be given through your veins, which is called as intravenous. So cancer chemotherapy which has been used for ovarian cancer are those which are taken intravenously. Example are paclitaxel and carboplatin. Now, this set of paclitaxel and carboplatin is given together, and when it is given, it is called cycle 1. Now, the second cycle, that is the second dose, is repeated after a particular interval. So this is given after 3 weeks. After 3 weeks, there is another cycle of paclitaxel and carboplatin that is repeated. Now, after 3 cycles of chemotherapy, the patient is checked if her disease has responded to the chemotherapy or not. And depending on that, the patient is taken up for surgery. Now, we also have targeted therapy for carcinoma ovary. Now, these are medicines which identify specific features that are present on the cancer cells. It may be a protein that is seen on cancer cells. So, some medicines, that is the targeted therapy, identifies these particular proteins which are present on the cancer cells and helps in killing those particular cancer cells. Examples of such medicines are bevacizumab. Now, radiotherapy is not the mainstay treatment of carcinoma ovary, but can be used in certain advanced cases or when the disease has not properly responded to other modalities of treatment. So, radiotherapy is basically use of X-ray treatment to kill the cancer cells that are present in the pelvic area. So once a patient has taken treatment, we need to look at how much of the tumor has responded to the treatment that the patient has taken, and that is called response assessment. This is done using tumor markers like CA-125 or the use of ultrasound or CT of the abdomen and pelvis. And then finally we report it as complete response, partial response, progressive disease and stable disease. It is called complete response when the entire disease is not there anymore. It is called partial response when the disease has responded to chemotherapy but not fully responded. It is called progressive disease when disease has not responded to the chemotherapy treatment but has also increased from her initial stage of the disease. It is called stable disease when there is no change before treatment as well as after treatment, it remains the same. So coming to follow-up after treatment, there is it is important to follow up a patient to look for late effects of treatment and also to look at the disease status, whether there is the disease coming back or if there is a progress of the disease or if there is no evidence of the disease. So all this has to be recorded and we need to assess the date of follow-up, the method of follow-up, that is whether the patient herself has come to the hospital or she has sent through someone or spoken through phone or maybe visited or made a home visit. And also we need to look at her present life status because most of the patients after treatment, they have a tendency to stay away from everybody or to stay in constant fear, thinking if the disease is going to reappear again, or maybe the patient will have different mood disturbances or lack of sleep, lack of adequate sleep, loss of appetite, loss of weight. And also the major problem these patients will come across is fertility issue because the disease is occurring in the ovaries. Now, during the follow-up time and even after, we need to assess and look for any type of relapse. Relapse is when the disease comes back after complete treatment. So here again, we need to look at how the patient has presented, if she has come up with any symptoms, the duration, the pattern, and we need to assess her again like we have done initially, and also we need to record the treatment of relapse that has been provided. So for a patient who has received different types of different modalities of treatment, that is chemotherapy and surgery, she should be expected to develop different types of complications due to the treatment. So these treatment toxicities should be looked into, like neuropathy, thrombocytopenia and neutropenia, which is common after chemotherapy medications. Also thrombosis and perforation, which can occur following surgeries. So the details of these conditions, the management that has been provided for these conditions, and also how much the disease or how much the patient has responded to the complications and to the management, all details should be collected and recorded. Now, finally, coming to the rehabilitation part, so the patients should be kept under constant follow-up, and during each visit, they should be counseled regarding the disease, regarding their present disease status, their complications, the symptoms of the complications that can occur, as well as counsel them regarding their emotional and social status. Apart from this, the family members also need to be counseled and explained regarding the complications that can occur, the support they need to give to the patient as a family, and also to be vigilant about the symptoms that can reappear in case of relapse or recurrence or complications. So this is about a brief on ovarian carcinoma. Thank you.